Hello, Mr. Smith. I have some good news for you. Your new kidney is working well based on the labs from this morning, and you can go home this afternoon.
That's the best news I've had since they called to tell me they had a kidney for me.
Well, once you're home, it's very important that you keep all of your appointments with your local doctors so they can make sure that your kidney keeps working at its best. I just talked to your nephrologist, Dr. Kim, and I'll stay in touch with her to follow your progress. Since you live so far from the transplant center, you'll only come here if you have a problem, and all of us are working to make sure that doesn't happen.
Well, I'm really hoping, since I have the second chance, that I'm not going to have any more problems. What should I do?
Well, there are some very important things that you must do to lower your chances of having any problems. First, be sure to keep all of your medical appointments. You may not be able to tell if your body starts to reject your new kidney, but your doctors will follow your blood work and your tests very closely, especially at first, so they can tell how your kidney is working and make adjustments to your medication if they need to. The blood tests are also very important to determine the blood levels of your medicines and to detect any side effects. Secondly, it's very important for you to make some lifestyle changes. For example, you must stop smoking, change your diet, and start exercising. This is extremely important because having kidney disease can increase your risk for heart disease. In addition, some of the medications required to protect your kidney function can make these risk factors worse.
Wow, I knew there would be a lot of changes, but this is a little overwhelming. I'll do my best. As you can see, that diet part's going to be a challenge for me.
Well, that can be a challenge for all of us. It's important that your family understands how important these changes are so they can help you adjust. I also recommend that you join a support group in your area, because talking to other people who've been through what you're going to be going through can be very helpful.
Well, that sounds like a good idea.
Well, it's important that you take your medicines, especially your immunosuppressants, exactly as you're instructed. Your immune system will always know that your kidney came from someone else, so you have to take these medicines for the rest of your life to protect against rejection. Over time, we can probably lower the doses. One of the reasons we follow your blood work so closely is to fine-tune the transplant medicines that will work best for you and cause the fewest side effects. Now, do you have any questions before I go and write your discharge orders?
Yes. How much will all this medicine cost?
Well, because your medicines are so important, I've asked our pharmacist, Dr. Hamilton, to talk with you before you go home. He's also working with our discharge coordinator to make sure that you can get your medicines that you need and that they're covered by your insurance plan.
Well, it sounds like you've thought of everything, and that's good because this is a lot for me to remember.
Hello, Mr. Smith. I'm Dr. Hamilton, the transplant pharmacist. Now, I know you're anxious to go home, but I would like to take a few minutes to talk to you about your medications so you understand what they're for and how to take them. Taking them as directed is very important to make sure you do well when you get home.
Okay, I appreciate that.
All right, let's start with the basics. You'll be on 3 different kinds of medications. First, transplant medicines called immunosuppressants will keep your body from rejecting your new kidney. These include tacrolimus, mycophenolate mofetil, and prednisone. However, the immunosuppressants that protect your transplanted kidney can also keep your body from fighting off infections, so you'll have to take medications to protect you from infections caused by bacteria, viruses, and other organisms. Finally, you'll take medications to help prevent some of the side effects of the transplant medicines.
Wow, this is a lot to remember. It makes my head spin.
I know it can be confusing, but it is important to remember that you should never stop taking your immunosuppressant drugs and keep your appointments for monitoring to make sure you're on the best dose and regimen for you. You should also talk to your local pharmacist or doctor anytime you have a question. If you miss a dose, be sure to let one of them know and they can tell you what to do in that situation. I have a printout here for you that will help you remember how and when to take your medications. There's also a medication calendar, a daily checklist that you can use to keep track of when you should take them. I'll review all of that information with you in detail.
Well, this will help out a lot. I came in on about 5 medicines, and I'm leaving on a lot more than that.
I know it seems like a lot, but they're all important. You're also taking 2 medicines for your blood pressure, nifedipine, benazepril. They're also very important because high blood pressure can damage your new kidney, or cause a stroke, or a heart attack. You've also been prescribed a daily calcium and vitamin D supplement to protect your bones. You're also scheduled to get 1 more dose of a drug called pomidronate in about a month. It'll be given intravenously in the doctor's office and can protect your bone strength for several years. Do you have any questions at this point?
Well, I'm really worried that I won't do everything right. Even if I do, How long will my new kidney last?
The long-term success rates after a kidney transplant are good. The most important things you can do are to stick to your medication regimen and monitoring schedule and make the lifestyle changes that will protect your kidney. Be sure to tell your doctor or pharmacist if you're having any problems so they can determine if the problem is due to your medications and make any necessary changes.
That message is coming through loud and clear.
Good. Well, here's your medication calendar. Let's go through it step by step. We'll also talk about some ideas to make the other changes easier for you too.